I'm about to reveal something that changes everything you've been told about high blood pressure. I'm Dr. Curtis P. Langlotz, and after 28 years as a cardiologist, I've examined thousands of damaged arteries. I've held calcified blood vessels in my hands during surgery. I've seen what hypertension actually does to your cardiovascular system at the cellular level, and I can tell you with absolute certainty that almost everything you've been told about treating high blood pressure is wrong. You've been told hypertension is a plumbing problem, too much fluid in the pipes, your doctor tells you to cut salt, take a water pill, the diuretic removes fluid, your blood pressure drops, problem solved, except it's not solved. Because that explanation, that entire way of thinking about hypertension is a model from the 1970s. It's outdated, it's incomplete, and it's keeping you sick while your arteries silently rot from the inside. The truth is far more complex and far more important. Hypertension is not about how much fluid is in your pipes, it's about the pipes themselves. Your arteries aren't just full, they're damaged, they're stiff, they've undergone structural changes at the microscopic level that no blood pressure pill can fix. When I examine arteries during surgery, I can see this immediately. A healthy artery springs back when you touch it. It's elastic, flexible, alive. But a hypertensive artery crunches. It doesn't spring back. It's rigid, calcified. Sometimes I can barely get a surgical needle through because the walls have turned to concrete. That rigidity, that structural damage is what hypertension actually is. And here's what nobody tells you. Pills don't fix rigidity. Pills manage the pressure reading on your monitor. They manipulate fluid volume or vessel tone to bring the numbers down, but they don't repair the structural damage. They don't restore elasticity. They don't heal the vessel wall. They put a bandage on a problem that requires cellular reconstruction. By the end of this video, you'll understand exactly how to actually reverse this damage. You'll understand the 3 hidden mechanisms that created your hypertension in the first place, mechanisms your doctor never explained because most doctors don't understand them. And you'll understand the 4-step protocol to reverse the damage, not manage it, not control it, reverse it. This is not theory, this is cellular biology. This is what I've seen work in patients who were told they'd be on medication for life. Stay with me because what you're about to learn could free you from blood pressure medication forever. Comment your current blood pressure reading right now, both numbers. I want to see what we're dealing with. Let's start with what hypertension actually is at the cellular level. Your arteries are not simple pipes. They're complex living structures made of 3 layers. The innermost layer, the one touching your blood, is called the endothelium. It's a single layer of cells thinner than tissue paper that lines every blood vessel in your body. This layer is not just a barrier, it's an active organ. It produces chemicals that control blood flow, prevent clotting, regulate inflammation, and keep your vessels healthy. When your endothelium is healthy, your blood pressure is normal. When your endothelium is damaged, hypertension develops. But here's something most doctors don't know. The endothelium itself has a protective coating, a microscopic layer called the glycocalyx. Think of it as a Teflon coating on the inside of your arteries. This coating is made of sugar molecules and proteins. It's only a few micrometers thick. You can't see it with the naked eye, but it's one of the most important structures in your cardiovascular system. The glycocalyx creates a smooth, slippery surface that allows blood to flow without friction. It prevents inflammatory molecules from reaching the vessel wall. It senses blood flow and signals the endothelium to release nitric oxide, a gas that keeps vessels relaxed and open. When your glycocalyx is intact, your vessels stay healthy and flexible, your blood pressure stays normal. But when the glycocalyx is damaged, everything falls apart. And here's what damages it: high blood sugar, chronic inflammation, smoking, oxidative stress. These factors strip away the glycocalyx like acid-dissolving Teflon. Once it's gone, your vessel wall is exposed. Inflammatory molecules attach to the endothelium. White blood cells stick to the wall. LDL cholesterol penetrates the vessel. Plaque begins to form. The endothelium stops producing nitric oxide. Your vessels constrict. They become stiff. Your blood pressure rises. This is the first mechanism of hypertension, glycocalyx destruction. And here's the critical point. No blood pressure medication repairs the glycocalyx. ACE inhibitors don't repair it. Calcium channel blockers don't repair it. Diuretics definitely don't repair it. They manage the pressure, but the underlying damage remains. So your blood pressure might be controlled on medication, but your vessels are still damaged, still vulnerable, still progressing towards stroke or heart attack. This is why people on blood pressure medication still have cardiovascular events. The medication treats the symptom, not the cause. Let me tell you about Richard. He was 69 years old. He'd been on 3 blood pressure medications for 9 years: amlodipine, lisinopril, hydrochlorothiazide. His blood pressure was well controlled at 126 over 80. His doctor was thrilled. Richard felt fine. Then one morning he had a heart attack. Not a massive one, a moderate one, but enough to put him in the hospital for emergency intervention. When they examined his coronary arteries, the problem was obvious. His arteries were calcified, rigid. The walls were like stone. Richard's 9 years on blood pressure medication had given him and his doctors a false sense of security. They thought controlling the number meant controlling the disease. They were catastrophically wrong. The disease had been progressing silently the entire time while everyone celebrated his perfect blood pressure readings. Comment controlled but worried if you're on blood pressure medication and wondering if the same thing could happen to you. I need to see how many people are in this situation. This brings us to the second mechanism, arterial stiffness. This is the one most doctors completely miss. They focus on your blood pressure numbers, 120 over 80, 140 over 90, but they ignore whether your arteries are stiff or flexible, and that matters more than the numbers themselves. Here's why. Blood pressure has two numbers, systolic over diastolic. Systolic is the pressure when your heart contracts. Diastolic is the pressure when your heart relaxes. In a healthy person with flexible arteries, these numbers might be 120 over 80. The difference between them is 40. This difference is called pulse pressure. Pulse pressure tells you about arterial stiffness. A normal pulse pressure is 40 to 50. But as your arteries stiffen, something specific happens. Your systolic pressure goes up while your diastolic pressure stays the same or even drops. You might end up with blood pressure of 158 over 68. The systolic is high. The diastolic is actually low. But the pulse pressure is 90. This wide pulse pressure, anything over 60, tells me your arteries are stiff and calcified. Your aorta has lost its elasticity. Here's what's happening mechanically. When your heart contracts, it ejects blood into your aorta. In a healthy, flexible aorta, the vessel expands to absorb some of that pressure. It acts like a shock absorber, keeping your systolic pressure moderate. Then, when your heart relaxes, the aorta recoils, squeezing blood forward and maintaining your diastolic pressure. But when your aorta is stiff, it can't expand. It can't absorb the pressure. So all the force from your heart's contraction slams directly into your vessels. Your systolic pressure spikes. Then when your heart relaxes, the stiff aorta can't recoil. Your diastolic pressure drops. The result is wide pulse pressure, and this pattern predicts stroke and heart attack better than the individual numbers themselves. A person with blood pressure of 156 over 98 has high pressure, but relatively normal arterial stiffness. The pulse pressure is 58. A person with blood pressure of 156 over 68 has the same systolic but severe arterial stiffness. The pulse pressure is 88. The second person is at much higher risk, even though their diastolic looks better. But most doctors don't calculate pulse pressure. They just see elevated systolic and prescribe medication. They miss the underlying problem entirely. What causes arterial stiffness? Your artery wall has 3 layers. The middle layer, called the tunica media, is made of smooth muscle cells and elastic fibers. This layer gives your arteries their flexibility. But as you age, and especially if you have hypertension, diabetes, or chronic inflammation, several things happen. First, calcium deposits form. Calcium belongs in your bones, not your arteries. But when your vessels are inflamed, calcium migrates from your bloodstream into the vessel wall and forms crystals. These crystals make the wall rigid. Second, the elastic fibers break down and are replaced by stiff collagen. Third, the smooth muscle cells undergo a transformation. They stop acting like muscle and start acting like bone cells. They actively calcify the vessel wall. This process is called vascular calcification, and by the time you're 65, if you've had hypertension for years, your arteries look more like bone than blood vessels. And here's what's devastating. No blood pressure medication reverses this. ACE inhibitors don't remove calcium from vessel walls. Calcium channel blockers block calcium from entering smooth muscle cells, which helps them relax, but they don't remove calcium already deposited in the wall. The calcification remains. The stiffness remains. So can you reverse arterial calcification? Can you remove calcium from vessel walls and restore flexibility? The answer is yes, but not with medication. With specific nutritional interventions that most doctors have never heard of, I'll explain exactly how in the protocol. Comment your most recent blood pressure reading and calculate your pulse pressure. Just subtract the bottom number from the top number. Comment like this: 148 over 82, pulse pressure 66. I want to see where people stand. Now, the third mechanism, and this one explains why reducing salt doesn't work for most people, why diuretics provide temporary relief but don't fix the problem, why some people can eat salt freely and maintain normal blood pressure while others restrict salt religiously and their pressure stays high. It all comes down to insulin. Your kidneys control blood pressure by regulating sodium. If you eat too much sodium, your kidneys should excrete the excess. If you eat too little, your kidneys should retain it. This keeps your blood volume stable and your blood pressure normal. But this system depends on your kidneys responding appropriately. And here's the problem. Insulin blocks sodium excretion. When insulin levels are high, your kidneys hold on to sodium no matter how little you're eating. This made sense evolutionarily. Insulin is released when you eat. When food was scarce, our ancestors needed to conserve every nutrient, including sodium. So insulin signaled the kidneys to retain sodium, ensuring adequate blood volume during times of fasting. But in modern life, where we eat constantly and insulin levels are chronically elevated, this mechanism becomes pathological. Your kidneys are locked in sodium retention mode. You could eat zero salt, and your kidneys would still recycle every milligram of sodium in your body. Your blood volume stays elevated, your blood pressure stays high. This is why salt restriction fails for so many people. It's not that salt doesn't matter, it's that if your insulin is high, your kidneys won't excrete salt no matter how little you consume. The lock is insulin, not salt. Insulin directly stimulates sodium reabsorption in the kidney tubules. It activates the sympathetic nervous system, causing your kidneys to release renin, which triggers aldosterone release. Aldosterone tells your kidneys to hold on to sodium. Insulin also increases your blood vessels' sensitivity to angiotensin, a powerful vasoconstrictor. So high insulin causes sodium retention, activates hormones that cause more retention, and makes your vessels constrict. All three effects raise blood pressure. This is why people with insulin resistance, prediabetes, or type 2 diabetes almost always have hypertension. The insulin is locking their kidneys. And here's the critical point. You can have insulin resistance without having diabetes. Your fasting blood sugar might be normal, your A1C might be normal, but your insulin levels could be elevated, and that elevated insulin is driving your hypertension. Most doctors never check insulin levels. They check glucose and A1C. If those are normal, they assume insulin is fine. They're wrong. You can have normal glucose with high insulin for years before glucose starts rising. During that time, high insulin is damaging your vessels and raising your blood pressure. Let me tell you about Patricia. She was 64 years old with hypertension for 12 years. She'd tried everything, salt restriction, the DASH diet, 3 different medications. Her blood pressure was still 144/88. She was frustrated and scared. I checked her fasting insulin, something her previous doctors had never done. It was 22. Normal is below 10. Her insulin was more than double what it should be, and it was locking her kidneys in retention mode. No amount of salt restriction would work because the problem wasn't salt. The problem was insulin. We started her on an insulin-lowering protocol that I'll share with you shortly. Within 12 weeks, her fasting insulin dropped to 9. Her blood pressure dropped to 124/78. We reduced one medication. Within 6 months, her insulin was 7, her blood pressure was 118/74, and she was off all blood pressure medication for the first time in 12 years. Her kidneys had unlocked. They were finally able to excrete sodium normally. Her blood pressure normalized because we fixed the mechanism that was elevating it. Comment insulin if you suspect your blood sugar issues might be connected to your blood pressure. I want to see how many people are making this connection. Now let me give you the complete 4-step protocol to reverse all 3 mechanisms. This is what I've seen work in patient after patient. Step 1 is glycocalyx restoration. You must rebuild the Teflon coating inside your arteries. First, you have to stop destroying it. The primary destroyers are high blood sugar and oxidative stress. Every time your blood sugar spikes above 140, it damages the glycocalyx. The sugar molecules react with proteins in the coating through a process called glycation, making the coating stiff and dysfunctional until it breaks apart. So you must stabilize your blood sugar by keeping post-meal glucose below 140 at all times. For most people, this means reducing refined carbohydrates. Not eliminating carbohydrates, but choosing ones that don't spike blood sugar. Vegetables, legumes, some fruits. Avoid sugar, white bread, white rice, pasta, pastries. The foods that send your blood sugar from 90 to 180 in 30 minutes. Those spikes are destroying your glycocalyx with every meal. Second, you must provide the building blocks to rebuild it. The glycocalyx is made of molecules called glycosaminoglycans, long chains of sulfated sugars. Your body can make these, but it needs raw materials. The best dietary sources are sulfated polysaccharides from seaweed, specifically fucoidan from brown seaweed. Studies have shown these compounds restore glycocalyx thickness and improve endothelial function. Supplements containing fucoidan are available, and the studies showing benefit use doses of 500 to 1,000 milligrams daily. Third, you must reduce oxidative stress with antioxidants from food, not supplements. The most potent antioxidants for vascular health are polyphenols from colorful vegetables and fruits, berries, leafy greens, beets, dark chocolate, green tea. These compounds neutralize free radicals before they can damage your glycocalyx. So let me tell you about Walter. He was 71 years old with hypertension for 16 years on 2 medications. His blood pressure was controlled at 130/82, but his endothelial function test showed poor vessel dilation, only 4%. Normal is above 10%. His glycocalyx was damaged even though his numbers looked acceptable. We started him on the glycocalyx protocol, eliminated refined carbohydrates, added fucoidan 1,000 milligrams daily, increased polyphenol-rich foods with a cup of berries and 2 cups of leafy greens every day. After 3 months, his endothelial function improved to 11%. His vessels had regained flexibility. His blood pressure dropped from 130/82 on 2 medications to 116/74. We eliminated 1 medication. After 6 months, he was off both medications entirely with blood pressure of 120/76. His glycocalyx had healed. Step 2 is decalcification. This is the most misunderstood aspect of vascular health. Most people think once calcium deposits in arteries, it's permanent. They're wrong. Calcium can be removed, but only if you understand the mechanism. Calcium doesn't randomly deposit in your vessels. It's transported there by specific proteins and kept there by the absence of other proteins. The key protein is matrix GLA protein, or MGP. This protein acts like a traffic cop telling calcium where to go. When MGP is activated, it directs calcium to your bones where it belongs. When MGP is inactive, calcium wanders into your arteries. Here's the critical point. MGP is activated by vitamin K2, specifically the MK7 form. Without adequate vitamin K2, MGP remains inactive and calcium deposits in your arteries. With adequate vitamin K2, MGP redirects calcium out of your arteries and into your bones. This has been demonstrated in studies where vitamin K2 supplementation slowed or reversed arterial calcification. The studies used doses of 180 to 360 micrograms daily of MK7, but vitamin K2 is only part of the equation. Calcium needs vitamin D to enter your bones. Without adequate vitamin D, the calcium redirected by K2 has nowhere to go. So you need both. Vitamin K2 to pull calcium out of arteries, vitamin D to push it into bones. The third piece is magnesium. Magnesium is nature's calcium channel blocker. When magnesium levels are adequate, it blocks calcium from entering smooth muscle cells, keeping vessels relaxed. When magnesium is deficient, calcium floods in, cells contract, vessels constrict, blood pressure rises. Magnesium also prevents calcium from forming crystals in vessel walls. Even if calcium is present, magnesium keeps it dissolved. Most people are deficient because magnesium is found primarily in dark leafy greens, nuts, seeds, and whole grains, foods most people don't eat enough of. The solution is magnesium supplementation, but not magnesium oxide, which is poorly absorbed. You need magnesium glycinate or magnesium threonate at 400 to 600 milligrams daily. Let me tell you about Eleanor. She was 74 with hypertension for 22 years on 4 medications. Her blood pressure was barely controlled at 142/86. A CT scan showed severe calcification of her aorta. Her cardiovascular risk was extremely high. We started her on the decalcification protocol, vitamin K2 at 360 micrograms daily, vitamin D at 5,000 IU daily because her level was low, magnesium glycinate at 600 milligrams daily. After 6 months, we repeated her CT scan. Her calcification score had decreased by 9%. Any regression is remarkable because arterial calcification is supposed to be progressive. The fact that it went backward meant the protocol was working. Her blood pressure had dropped to 128/78, and we reduced her to 3 medications. After 18 months, her calcium score had decreased by 17%. She was on 1 medication with blood pressure of 122/76. The decalcification protocol had restored her arterial flexibility. Step 3 is nitric oxide restoration. Nitric oxide is a gas produced by your endothelial cells that tells smooth muscle to relax. When nitric oxide is released, your vessels dilate, blood flows easily, blood pressure drops. Healthy endothelium produces nitric oxide constantly. But when your endothelium is damaged, nitric oxide production drops. Your vessels can't relax, they stay constricted. Blood pressure rises. The enzyme that makes nitric oxide is called endothelial nitric oxide synthase, or eNOS. This enzyme needs cofactors to work properly, especially a molecule called BH4. When BH4 is adequate, eNOS produces nitric oxide. When BH4 is depleted by oxidative stress, eNOS becomes dysfunctional and produces harmful free radicals instead. This is called eNOS uncoupling. Reducing oxidative stress through polyphenol-rich foods protects BH4. You can also support it with adequate folate from leafy greens, vitamin C from citrus and berries, and vitamin E from nuts and seeds. But the most powerful intervention is stimulating NOS through shear stress, the friction of blood flowing across the endothelium. When blood flow increases, friction activates NOS, nitric oxide is produced, and vessels dilate. This is why exercise lowers blood pressure. But there's a specific type of exercise that's particularly effective: isometric hand grip training. This involves squeezing a hand grip device at 30% of your maximum strength for 2 minutes, resting 1 minute, and repeating 4 times. This protocol has been shown in multiple studies to lower blood pressure by 10 to 15 points, systolic, after 8 weeks. The sustained muscle contraction compresses blood vessels in your forearm. When you release, there's a rush of blood flow, creating massive shear stress. This activates eNOS and floods your system with nitric oxide. Over time, your baseline nitric oxide production increases and your blood pressure drops permanently. Let me tell you about Donald. He was 67 with hypertension and prediabetes. His fasting glucose was 106. His A1C was 5.8, but his fasting insulin was 19, nearly double what it should be. We started the insulin reset, time-restricted eating with a 16.8 schedule, resistance training 3 times weekly, apple cider vinegar before meals, cinnamon daily. After 8 weeks, his fasting insulin dropped to 12. His blood pressure went from 146/90 on 2 medications to 130/82. We reduced 1 medication. After 16 weeks, his insulin was 8, his blood pressure was 120/76, and we eliminated the second medication. He's been medication-free for 2 years now with normal blood pressure because we fixed the mechanism that was raising it. Comment which step you're going to start with this week. Comment glycocalyx, or decalcification, or nitric oxide, or insulin reset. Just pick one and start. I want to see people taking action. Now, let me be absolutely clear about something important. I'm not telling you to stop your blood pressure medication. That would be dangerous. What I'm telling you is that medication manages symptoms while these protocols fix causes. You need both initially. Start the protocols while continuing your medication. As your blood pressure improves, work with your doctor to reduce medication gradually. Monitor your blood pressure daily. Track the trends. When your numbers consistently improve, that's when you discuss reducing medication with your physician. Never stop medication abruptly. Never reduce without supervision. But also don't accept that you'll be on medication for life. That's what you've been told because standard medicine doesn't know how to reverse vascular damage. They only know how to manage pressure. But you now know differently. You understand the glycocalyx. You understand arterial calcification. You understand nitric oxide. You understand the insulin-kidney connection. When you understand mechanisms, you can fix them. I think about Richard often, the patient who had a heart attack despite 9 years of perfect blood pressure control. His doctors celebrated his numbers while his arteries turned to stone. They managed his pressure while his disease progressed silently. He trusted a system that gave him false security. If someone had explained these mechanisms to Richard 9 years earlier, if someone had shown him how to reverse vascular damage instead of just managing a number, I believe he would have avoided that heart attack entirely. His arteries would have remained flexible. His glycocalyx would have stayed intact. His calcium score would have improved instead of worsened. That's why I made this video, so that you have information Richard never had, so that you understand what hypertension actually is and how to reverse it, not manage it, reverse it. You now know the truth. Hypertension is not a plumbing problem. It's structural damage to your arteries. Glycocalyx destruction, arterial calcification, nitric oxide deficiency, insulin locking your kidneys. These four mechanisms create hypertension, and standard care doesn't address any of them. Pills manipulate pressure without repairing damage, but you can repair the damage. Glycocalyx restoration with blood sugar control, fucoidan, and antioxidants. Decalcification with vitamin K2, vitamin D, and magnesium. Nitric oxide restoration with shear stress, exercise, and nasal breathing. Insulin reset with time-restricted eating and resistance training. These four steps reverse the mechanisms. When you reverse the mechanisms, blood pressure normalizes on its own, not because you're forcing it down with medication, but because you've repaired your vascular system. If this video opened your eyes to what hypertension actually is and how to reverse it, share it with someone you love who's struggling with blood pressure. Share it with your spouse, your parents, your siblings, anyone on blood pressure medication who's been told they'll be on pills for life. This information could change their future. Subscribe to this channel because I'm committed to sharing the knowledge that keeps people out of operating rooms. Leave a comment telling me your blood pressure story. Were you surprised to learn that medication doesn't fix the underlying damage? What step are you going to start with? I read every comment, and your questions help me create content that serves you better. Take care of your vessels. They're the only ones you have. And remember, hypertension isn't a life sentence. It's a reversible condition if you're willing to understand the mechanisms and do the work to fix them. I'll see you in the next video.